Hi everyone, my name is Natalie Liu San Zhao, and today I'm going to discuss about introduction of stress. First, stress is a process in which individual, example like athletes, perceive difference between what is being asked of them and their ability to cope when fear has important consequences. Stress can be defined as anxious or threatening feeling that a person experiences when they interpret a situation has become more than their psychological resource able to deal. Secondly, coping strategy is a way sport psychology help athletes manage their stress. And the example of cognitive coping strategy is self self-talk to control identification of self-symptoms, self-monitoring of stress including training and relation techniques. In addition, to control is the one of coordinative coping strategy. This is to involve or changing negative thinking to positive thinking. Example, we can move an athlete to the described equation or goal. Lastly, athletes who can identify and recognize the level of stress at which they perform their best in their sport are able to use strategies to manage their emotion to increase the likelihood they will perform their best or higher potential or capability. And that's all for me. Thank you.
Hi, my name is Lim Junjing. I'm from the Faculty of Business in Bachelor of Banking and Finance. Today, we need to talk about stress. In daily life, the load or consumption of the body and mind can be regarded as stress, but there is no absolute answer to the definition of the word stress. Stress can be a stimulus from an individual internal or external environment, or it can be a reaction when a stimulus cannot be resolved after receiving the stimulus or a process of psychological adjustment. In summary, stress can be regarded as a complex of three aspects: stimulus, response, and process. In fact, stress is not all bad. If the stress level is low, it may be able to stimulate potential and even perform better, and the harm to the body will be less. Conversely, if the stress cannot be resolved or released for a long time, and it exceeds the critical point of stress resistance, not only will it increase the wear and tear of the body system, and it is more likely to affect the body's repair and defense capabilities. Excessive stress can lead to some symptoms, and physiological symptoms are one of them. So, what are physiological symptoms? Physiological symptoms are how your body physically responds when you are stressed. For instance, vomiting, diarrhea, insomnia, fatigue, overeating, and others. Let us take some simple examples from our life to understand the physiological symptoms. Okay, for example, when the exam comes, we will feel pressure because we are afraid of getting unsatisfactory results. On the days of the exam, we may lose our appetite because we are too stressed and not in the mood to eat. Or we may overeat because we have to temporarily release the pressure from ingesting food. Then we will also feel tired easily throughout the day because we have to study for exam. But before going bed, we are prone to insomnia because our minds are full of thought about the culprit of stress, which is the exam, and we don't get enough sleep. When the day of the exam comes, we may vomit or have diarrhea. When we are in the exam room, we will be shivering and sweating. These are the so-called physical symptoms of stress. I believe that the physical symptoms of stress are inevitable for everyone. In the end, I would like to say that stress in life is inevitable, but we should release the stress appropriately, and when the stress is too great, we can seek help to avoid situations that endanger our body and mind. That's all for me. Thank you.
Hi, I'm Tilden. I'm now 21 years old, studying first year law degree program in Multimedia University. My sport group is netball. Today, I gonna share about the ways to identify the stress symptoms, which is the behavioral symptoms, which include the lack of sleep, addiction of drugs and alcohol, and also loss of appetite.
Dr. Annis Wilson stated that people who are stressed will think excessively about responsibility such as work, family, and finance. For teens and young adults in school, this stress often focuses on exam and other important assignments. So, when one attempts to fall asleep, those thoughts continue and cause numerous disruptions in sleep patterns. It can cause awakening during day and night. It leads people to feel like their sleep is less restful. So even you are up for large periods of time, perhaps you are not sleeping as deeply as you normally would, and you are more restless in your sleep. Besides that, stress is another factor toward developing a drug or alcohol addiction. This is because as an individual try to find ways to cope with the job-related stress, they may begin to self-medicate to deal with the pressure being placed on them. Over time, these changes can make it extremely difficult for someone to stop using substances, even when they want to, despite negative consequences to their life and health. The negative consequences of one substance use, which may include economic instability, job loss, relationship strain, and medical and psychological health problems, can significantly increase one's overall stress level. This diagram shows that the effect of drug or alcohol addiction on the physical health, such as high blood pressure in heart, inflammation in the liver, and acute kidney failure. Besides that, it also causes inflammation and swelling of blood vessels in pancreas, and also it increases the risk of diseases such as tuberculosis in our immune system. Moreover, stress will also lead to loss of appetite. A person with stress will often lose interest in activities that they once enjoyed. Sometimes, this means that the pressure they used to gain from preparing and eating food disappears. In addition, stress can cause people to feel sad, worthless, and hopeless. With so much going on in their mind, they can forget to eat. People who tend to feel low in energy when they are stressed means that having to cook or eat may feel like too much to them. That's all from my sharing. Let's proceed to the next one.
Thank you, Jane, for explaining the behavioral symptom of stress. My name is Ding Ying, and I'm from Faculty of Law, currently studying law, and I'm going to talk about the cognitive symptom of stress. Stress is a natural human response that we develop in order to be aware of and protect ourselves from danger, and one of the stress symptoms is cognitive symptoms. It can affect your cognitive functioning. Your brain needs to allocate resources to the stressful situation at hand, which can take energy away from other cognitive abilities. When we talk about the cognitive effect of stress, we are referring to any manner in which stress affects your brain's ability to complete tasks, both simple and complex. Cognitive skill can include anything from solving problems to memorizing things. Here are 5 specific ways that stress can affect your cognitive skill. The first one is forgetfulness. Stress can affect your brain in a way that makes you more forgetful than usual or even misremember things. This could be because your brain needs to allocate energy to other tasks during the time of stress, leading you to absent-mindedly making careless mistakes. Secondly, stress can also lead to more rigid thinking style. When you are under stress, you are more likely to make decisions out of habit. When you are free of stress, your brain is more flexible, which allows you to make decisions based on your big picture goals. Thirdly, people who are under a lot of stress often have a hard time with concentration and focus. You might find that you can pay closer attention to the situation that's causing you stress, but have a hard time concentrating or on anything else. If you're highly stressed, you could find your attention wandering even during important conversation and meeting. Problems with focus could become so severe that they start interfering with your functioning at home or work. For example, I have a few assignments which due on the same week and I was under a lot of stress because I worry I can't finish them on time. during lecture class, I can't focus on the lecture but keep thinking my assignment. Oh my god, how if I can't pass it up on time, I will fail this subject, I'm gonna retake this subject. At the end of class, I don't even learn anything of that subject. Moreover, stress also affects your thinking and can cause worries to constantly run through your mind. You might notice that when you are facing high level of stress, it's difficult to stop worrying about whatever is causing the stress. You could worry about the stressful aspect of work even when you are not there, or worry about your relationship when you need to be working. Last but not least, stress can cause you to make poor decisions. Even if you typically have good judgment, the cognitive effect of stress could cause you to be more impulsive than usual or simply fail to think decisions through. For example, I was playing chess with my father and I was going to lose it. I was under a lot of stress and I can't decide my next move properly, and I keep making poor decisions even if I usually have a good technique while playing chess. Chronic stress can cause an inflammatory response along with other biological changes in your brain, which can lead to the cognitive decline. If you are under high amounts of stress, consider practicing self-care and speak with a mental health professional if needed. That's all of my part. I will pass it to the next person. Thank you.
Thank you, Dingying, and good day, everyone. My name is Tan Xinzi. I'm a student from degree first year Banking and Finance. Now, I would like to continue the stress coping strategy for the last identification of stress symptom, which is emotional symptoms. So, what does stress feel like? It often contributes to fear, overwork, and frustration. You may feel physically exhausted, worn out, and unable to cope. And how can we realize whether we are having emotional symptoms? Here is the scenario of emotional symptoms. One of the most common signs that you might be experiencing is mood swings. For example, when I'm having this symptom, I will become easily frustrated, moody, and having all kinds of emotions. And I will find it difficult to control it. I may suddenly outburst of anger and happy the next, which my emotional is unpredictable for a few days or longer. And this kind of feeling up and down will happen with no reason, which I would not know why I suddenly become extremely angry and happy. In addition, another sign of emotional symptom is you may experience apathy, which is one of the form of depression. You will lose interest at the things you used to enjoy. For example, I'm the person who like to socialize, meeting new friends, or trying new things. One day, I found that I'm disinterested on it and reject to do the things that I used to. As I may feel more pressure to be expressive, I began to feel like my life does not matter, which caused me loss of motivation and interest to do anything and not care about things going around me. For this symptom, rather than feeling all kind of emotional, you don't feel much of anything. Things that used to make you happy, you will not become excited anymore. And you will no longer feel motivated to achieve your goals. In a nutshell, stress is not always easy to recognize, but there are some ways to identify some signs that you might be experiencing too much pressure. Sometimes stress can come from an oversource, but sometimes even small daily stresses from work, school, family, and friends can take a toll on your mind and body. If you think stress might be affecting you, you may first identify what kind of stress symptom you are having, which we have mentioned before, like physiological symptoms, behavioral symptoms, cognitive symptoms, and the last one is emotional symptoms. So if you related to those symptoms, The best resource is a therapist. You can seek for mental health professional to deal with your problems. That's all from us. Thank you.